Having high blood pressure, hyperlipidemia, or diabetes and taking medication does not mean I have been cured. It means I have postponed complications. Medication is a temporary measure, and fundamental treatment requires lifestyle improvement. First, among foods that improve blood vessel condition, the most important thing is that medications cannot cure chronic metabolic diseases, which we call adult diseases. Let me start with high blood pressure. When you forcibly lower blood pressure to supply oxygen to tissues, it means the blood vessels are narrowed. For example, the coronary arteries that supply the heart branch immediately from the aorta, which is a large artery. These coronary arteries are thin and directly connected to the aorta. So, when blood pressure rises, these vessels can easily get blocked or tear. High blood pressure can cause brain hemorrhage, heart attacks, coronary artery rupture, or aortic dissection, all of which are life-threatening complications. Therefore, blood pressure must be lowered to prevent these complications. However, lowering blood pressure forcibly with medication only worsens the condition of peripheral blood vessels. These vessels become more hypoxic and the condition deteriorates. Of course, if high blood pressure is untreated, it poses an immediate risk, so medication is necessary, but taking medication does not mean the disease is cured, it just postpones complications. The same applies to diabetes. If you forcibly lower blood sugar without addressing insulin resistance, the cells and muscles will still be insulin resistant, and the metabolism of sugar in tissues remains impaired. This maintains tissue hypoxia and acidemia, so the problem is not resolved. In the long term, this leads to peripheral vascular complications, dialysis, blindness, diabetic foot ulcers, neuropathy, vomiting, and other issues. So treating diabetes only by lowering blood sugar delays complications but does not cure the disease. As peripheral blood vessels worsen, these chronic metabolic diseases can also lead to severe diseases like cancer. Therefore, fundamental treatment is necessary. When blood tests show high cholesterol or triglycerides, it means there was a recent excessive intake of fats within the past 2 weeks. In emergency rooms, lipid profiles are checked. Recently, I saw a 30s male patient with triglycerides at 5,000, which is dangerously high. Even 1,000 would make the blood appear milky due to the fat content. I gave strong advice to change his diet, but in the Korean medical environment, due to short consultation times and patients' limited understanding, many are simply prescribed medication without sufficient lifestyle education, which is not ideal. Cardiologists prescribe many lipid-lowering drugs because studies show that lowering LDL cholesterol reduces cardiovascular disease risk. While lower LDL cholesterol is better, lowering it through medication without addressing lifestyle is not ideal because the body produces cholesterol naturally, and forcing it down with drugs can cause side effects. Simply maintaining the same diet and taking cholesterol medication is a flawed approach. People watching this video should try to reduce excessive fat intake through diet, improve insulin resistance through exercise, and understand that medication alone is not a cure. Reducing obesity helps with hypertension and diabetes. Fat cells are not dead but active, requiring energy metabolism and blood vessels to supply them. As fat tissue increases, blood vessels lengthen, increasing peripheral blood pressure, which raises overall blood pressure. This creates a vicious cycle. To break this cycle, we must avoid excess fat intake and fat accumulation. We often hear to avoid refined carbohydrates, and the problem lies in simple, processed carbs, not complex carbs. Simple carbs turn into fats in the blood because excess energy is converted to fat. The fat is stored between muscle cells, around the waist, and inside the abdomen, contributing greatly to metabolic disease. Not all carbs are bad. Complex carbs like whole grains digest slowly, providing steady energy and a slower rise in blood sugar, especially if chewed well. One of the worst simple carbs is high fructose corn syrup, which is used in many beverages and processed foods. It raises blood sugar sharply and quickly, worsening diabetes and metabolic diseases. We must also avoid bad fats, especially trans fats, which are worse than saturated fats. Trans fats are artificially hydrogenated oils like margarine and shortening, used because they are cheap and good for frying, but they are very harmful. Avoid foods containing trans fats and instead consume unsaturated fats without trans fats. Good options are perilla oil, avocado oil, and extra virgin olive oil. Use these oils for dressings or light cooking. Also, avoid frying at high temperatures or direct flame cooking, as these produce harmful substances. Regarding low-carb high-fat, LCHF, diets, protein is important to some extent because more muscle mass improves insulin sensitivity. The saying that thicker legs mean less risk of diabetes reflects that muscle cells take up sugar better. It's true, but that applies in normal conversation. These days, some people build their bodies by consuming protein shakes to gain muscle. For those people, there's an exception. Protein definitely produces a lot of nitrogen oxides in the body, and these substances can have harmful effects. For example, ammonia metabolism increases and puts a burden on the body. So, we need to deviate a bit from the usual protein myth. You can get enough protein from vegetables and brown rice. You should absolutely avoid consuming excessive amounts of protein shakes just to eat more protein. If you want to eat protein, it's better to consume a reasonable amount like 1 good egg or about 100 g of chicken breast, rather than excessive amounts. Many people ask about fats. The most representative diet involving fats is the low-carb, high-fat diet, LCHF. Many ask about this. The idea behind LCHF is to increase fat absorption, drastically reduce carbohydrates, and burn fat for energy through fat metabolism, which supposedly makes you lose weight faster. It is true that you lose weight faster this way. So, some people eat a lot of fat and drastically reduce carbs to lose weight. But the problem is whether this is good for the body. Such a diet is not very physiological and causes problems. Choosing the right fats is difficult. Some try cooking vegetables in butter, for example. I personally had to do LCHF for about 4 months due to family reasons. When you reach the point where ketones start coming out, you get dizzy, nauseous, and feel like you have a cold. This is caused by a deficiency of certain minerals, called the keto flu. It's a tough condition. So, pushing your body to produce ketones forcibly like that, even if it helps reduce weight immediately, is not really appropriate for the body's physiological functions. Instead of extreme diets just to lose weight, it's better to aim to normalize your body's metabolism. For that, a diet based on complex carbohydrates, whole grains, and vegetables is recommended. Now, regarding fats, if you eat good meat during LCHF, eat this, meaning recommended fats. People often ask about fats. MCT fats, also called medium-chain triglycerides, are often mentioned as good fats. Good fats are not simply eating lots of beef or pork fat because the fat in meat can contain toxic substances, and the meat we usually get has a very high omega-6 ratio, which promotes inflammation in the body. So, there is no need to purposely eat such fats. Of course, omega-6 is an essential unsaturated fat for the body, but if the amount is too high, it worsens inflammation. The best efficiency comes from eating fats with a proper balance, like omega-3 to omega-6 ratio around 1 to 2 to 1 to 4. Regarding meat, I've mentioned several times that cows and pigs need to eat grass to get the best omega-3 to omega-6 balance. But the animals we currently consume are fed grain feed, which causes an imbalanced high omega-6 ratio. This is why the meat available is often considered unhealthy. If you want to eat fats from meat, you should choose meat from animals that have been raised on clean pastures, eating only grass. But in today's factory farming environment, it's hard to find such meat. People tend to prefer fatty meats like pork belly or high-grade beef, which have a lot of fat. If you want to eat meat, try choosing cuts with less fat, like pork front leg or hind leg cuts. Avoid high-grade beef like 1++ grade because you end up paying more for less healthy meat. Choosing third-grade meat with less intramuscular fat is a better option. Don't just love pork belly so much. There are 4 special fats that protect your blood vessels and are good for vascular health. The most important ones are good fats, unsaturated fats, especially those rich in omega-3. You should avoid saturated fats that solidify at room temperature. Among unsaturated fats, omega-3 rich plant oils are very useful. One of them is perilla oil, which has a high omega-3 content. Perilla oil is pressed from perilla seeds, so it should be consumed quickly, ideally within 1 month after production. Eating whole perilla seeds is even better. You can eat them with a bit of sugar as a traditional Korean snack, but avoid eating them too sweet. Washing whole perilla seeds lightly in water and adding them to rice is also recommended. You can also do oil pulling with perilla oil to help intake omega-3 and improve the oral ecosystem. Other plant-based omega-3 rich foods include flax seeds, nuts like walnuts and pine nuts, and avocados. If you use these well, you can achieve very good exercise effects that most people don't know about. Exercise is very important. It's not just about burning calories for weight loss. If you think of exercise only as calorie burning, you realize you have to do a lot to burn the calories in 1 bowl of rice. For example, you'd have to run very fast for 30 minutes to burn that much. Exercise isn't just for weight loss. It helps deliver more oxygen to the cells, increases blood flow to the ends of peripheral vessels, acts like an antioxidant, opens peripheral blood vessels to raise temperature, and helps flush out metabolic waste. So, exercise is not only about burning calories but also about kickstarting your body's metabolism. Many people ask, if I avoid processed foods and junk food, then what should I eat? That means many foods we see now are far from physiological responses. So, first, avoid eating out. Restaurant food tends to have too much sugar, salt, and unhealthy additives. Avoid eating out. For people who work in offices, try to bring a packed lunch at least once a day instead of eating out or at company dinners. When you have to eat socially or can't avoid eating out, try to choose brown rice or whole grains and always have green vegetables alongside. Eat 6 to 7 types of vegetables daily. You can eat boiled or steamed vegetables, but fresh vegetables mixed with perilla oil or other oils are also good. Choose good meat wisely and apply these habits for a healthy diet.